Thank you so much for kind introduction. Today, I'd like to briefly review the anatomy of cardiac conduction system in normal heart, and then I will talk focusing on the conduction system in hearts with conotruncal anomalies. Cardiac conduction system, as you know, is composed of a sinoatrial node, a pacemaker, and atrioventricular node, delaying the electric impulse between atria to ventricles, and then atrioventricular bundle, the only track connecting the atrial and ventricular myocardium in the normal heart, and then divide into right and left bundle branches and Purkinje fibers propagating electric impulse to ventricles. At the right lateral view of the RA, SA node is located at the junction between entrance of SVC and the atrial appendage, which is the uppermost part of the sulcus terminalis. SA node is usually subepicardial side of sulcus terminalis, which is the corresponding structure of crista terminalis protruding into the cavity of right atrium. Next is the atrioventricular conduction tissue. The endocardial view of the right atrium, right heart, shows coast triangle limited by tendon of Todaro, coronary sinus opening, and tricuspid valve annulus. The apex of the triangle is the central fibrous body. Atrioventricular node is located near to the apex, indicated in yellow. Then atrioventricular bundle runs through central fibrous body, and it is the only portion connecting atrioventricular node to ventricular bundle branch. And here, this picture shows the septal surface of the right heart, and then here is the septal surface of the left ventricle. After his bundle penetrates the central fibrous body, it is divided into the right and left bundle branches. Right bundle branches runs along the trabecula septomarginalis and the moderate band as a thick major bundle. The left bundle branch spread onto the subendocardial septal surface of the left ventricle as several thin branches. Among the segments of the conduction system in hearts with conotruncal anomalies, it would be the position of atrioventricular conduction tissue that draws your attention. In order to find out the course of the atrioventricular conduction system in those heart of congenital heart disease, we have to check out some key questions. Is the atrioventricular junction separate or common? What is the arrangement of the ventricle, D loop or L loop? Are atrial septum and the ventricular septums aligned properly? Does the ventricular septum meet the cardiac crux? When we have answers for these questions, we can anticipate the most possible location of the atrioventricular conduction tissue. Concerning the location of atrioventricular conduction tissue, conotruncal anomalies may be divided into those with aligned septal components and those with malaligned septal components. In the case with the aligned septal components, the location of atrioventricular conduction tissue is dependent on the position of ventricular septal defect mainly, rather than the individual type of conotruncal anomalies. Ventricular septal defect is usually associated with the majority of the cases with conotruncal anomalies. The cases with malaligned septal components, such as corrected TGA, have atrioventricular conduction tissue at a very unusual location. Let's start with a simple VSD, because the type of VSD is important for the location of atrioventricular conduction tissue. Here, the first one is ventricular septal defect, perimembranous type, which the defect is located around the near to membranous septum. In the heart with the PMVSD, atrioventricular node is located in the normal position, indicated here as a red star. The yellow line indicates the location of the atrioventricular conduction axis. The bundle usually lies on the left ventricular aspect of the posterior inferior border of the VSD. These two hearts shows muscular VSD, but they are positioned in different parts of the septum. The position of the AV node here is the same as that of normal heart as well as the VSD-PM. The yellow line, the location of atrioventricular bundle, runs differently. Here, the ventricular septal defect muscular, trabecular cases, atrioventricular bundle located posterior inferiorly. However, muscular inlet VSD, the atrioventricular bundle located anterocephalad relatively to ventricular septal defect. In contrast to VSD-PM type, the bundle is relatively far away from the defect border though. This is a tetralogy of fellow heart, which the right free wall is open. The outlet septum is deviated anterosuperiorly to make the pulmonary outlet stenotic. In general, the conduction system in TOF follows the anatomic rule, which is noted previously for isolated VSD. So in the majority of the case of TOF, the VSD is perimembranous. So the AV node present in the normal position, and then atrioventricular bundle positioned the left ventricular aspect of the defect of the border. Infrequently, the bundle branch may be located on the top of the ventricular septum. So the most vulnerable site for surgical damage is the area of aortic, tricuspid, and mitral fibrous continuity area. Next is congenital heart disease with malaligned of atrial and ventricular septal components. The diagram shows where ventricular septum goes to the atrioventricular junction. When the septum goes to the crux, we anticipate a regular AV node in the normal position. However, the ventricular septum is deviated from the crux, then atrioventricular conduction tissue positioned abnormally. Corrected TJ is one of the congenital heart diseases which have an abnormal disposition of the atrioventricular conduction system along with the abnormal ventricular arrangement and the malalignment septal components. The heart of a congenital corrected TGA has a discordant atrioventricular connection. So the morphologically right atrium connecting to the morphologically LV and RA connect to morphologically right ventricle. And then ventricular arterial connection is also discordant. So left ventricle to pulmonary trunk and morphologically right ventricle connected to the aorta. So in this case, so the ventricular septum is malaligned to atrial septum. So regular AV node cannot connected to ventricular septum. So in this case, abnormal anterior node can be connected to atrioventricular bundle. But this one is runs anterior and superior to the pulmonary mitral valve. So when you look at the heart, then here is the regular AV node, and this is the abnormal anterior node. So atrioventricular bundle runs from the anterior node and then anteriorly and around VSD go to the septal surface to have bundle branches. There are a few exceptions of the disposition of atrioventricular conduction tissue in corrected TGA. In case where the pulmonary outflow tract is atretic or narrowed, then the septal alignment is rather normal, so malalignment is reduced. So in this case, posterior AV node is connected to the atrioventricular bundle or make a kind of a sling atrioventricular conduction system between posterior and anterior atrioventricular node. Another variation of the atrioventricular conduction tissue location in the corrected TGA is the mirror imaged atrial arrangement. In this case, also the atrial and ventricular septa is relatively better aligned. So this allows regularly located posterior AV node at the apex of the triangle of core to continue in normal fashion to the atrioventricular bundle. After giving the bundle branches, but sometimes the bundle branching bundle may continue as an anterior bundle, like this, to end blindly, not making contact with another AV node that is situated, is located anteriorly. Okay, that's all for today. Thank you so much for your attention.